Okay, so just to remind you again, the divisions of the nervous system. So we have the central nervous system, which is the brain and spinal cord. The brain and spinal cord is your control center, which receives information from the body and transmits or sends information to the rest of the body to perform an action. The peripheral nervous system is the one that connects the central nervous system to the body parts. The peripheral nervous system consists of cranial nerves and spinal nerves. Cranial nerves, you have 12 pairs, spinal nerves, you have 31 pairs. Now, among these peripheral nerves that are communicating with the central nervous system, you have two divisions. One is the sensory division or the afferent division that is going to carry information from your body parts to the CNS. This includes sensory information going from your skin, deeper tissues, muscles and joints. It includes information going from your special senses, and it also includes information going from your internal organs. So you have the sensory division, you have the somatic sensory division, that is which goes from your body parts, skin and deeper structures, and the visceral sensory fibers which go from your internal organs. Okay, they carry the information up to the brain and the spinal cord. The brain and the spinal cord interprets the information, and then it decides what needs to be done, and it sends information back to the body parts through what is called the motor or the efferent division. Now, the motor or efferent division, just like this is divided into somatic and visceral, the motor division is also divided into the somatic division and the visceral division. The visceral division is the autonomic nervous system. The somatic division is voluntary. It controls all the skeletal muscles. So your skeletal muscles respond because of this. Okay? And the autonomic nervous system is the one that is going to control your involuntary functions, which are part of your internal body, like controlling your heart, controlling your breathing, controlling your digestive processes or urinary processes. So this autonomic nervous system controls smooth muscles, glands and cardiac muscle, the heart. Okay? The autonomic nervous system is further divided into two big divisions, sympathetic division and parasympathetic division. So this is what we are going to look at today. We looked at sensations, special sensations, general sensations. We looked at motor division, upper motor neuron in the cerebral cortex, lower motor neuron in the spinal cord, and then we saw reflexes, which is this one. And now we are going to look at the autonomic nervous system. So the autonomic nervous system controls all your internal processes. Okay, it's also referred to as the visceral motor division because this is going to control internal organs, and the main purpose of this division is to maintain homeostasis, parasympathetic and sympathetic. So most of the vital functions, when we say vital, that means something that is necessary for life, okay, without which life cannot proceed. So it controls most of the vital functions like your heart rate, blood pressure, your breathing rate, your digestive processes, your urinary processes, all of this which are not under your control, your voluntary control. Okay? And like I've already mentioned before, the sympathetic nervous system or the sympathetic division of the autonomic nervous system, this is generally referred to as the fight or flight system. Fight or flight. That means this is the division which is responsible for helping you to handle your day-to-day activities or any stressful situation. Fight or flight. Okay? And the parasympathetic division functions to maintain all the activities during rest, okay, while resting. Parasympathetic nervous system is referred to as the rest and digest system. Okay, so that way you'll be able to remember what the actions are. Now, so anything, this is the general pathway, okay? So from an internal organ, the sensory division that is going to carry the information to a part of your brain or the spinal cord, and then you're going to have a motor neuron that's going to come and supply the organ, okay? So we are actually looking at this division now, okay? We're looking at this one. So, there is no time when only one system is active and the other system is inactive between these two, okay? There's nothing like that. Both of them, there is a balance, okay? There is always a balance between the parasympathetic activity and the sympathetic activity. So, during your waking time, when you are awake, sympathetic activity predominates, okay? Parasympathetic activity is still going on, but it is at a lower level. And then during your resting state, the parasympathetic activity is predominant, sympathetic activity is minimal, okay? So, never think that one system is going to function, the other one is going to be inactive. No, that's not the case. It's always a balance between the sympathetic and the parasympathetic nervous system, which helps to maintain homeostasis, okay? So, let's take a look at what is the difference. Now, this is a diagram which is not there in your textbook. It's from a different one, but it's a simple one. It helps you to understand the difference in the structure of the somatic nervous system. So, remember, somatic division supplies your skeletal muscle. It's the motor division that is supplying your skeletal muscle. And the autonomic nervous system is for your internal organs. So, the somatic nervous system, the one that supplies your muscles and makes your muscles contract, the neuron that is going to send the nerve to the muscle, the cell body of the neuron is in the brain or the spinal cord. Okay? It will be in the brain for the muscles of the face, and it will be in the spinal cord for the muscles of the rest of the body, skeletal muscles. Okay? So, this is what we call the lower motor neuron. The lower motor neuron is in the brain or in the spinal cord, and from there the motor nerve emerges and it goes all the way directly to the skeletal muscle that it is going to supply. Okay? And of course, you know this is the neuromuscular junction. So, what is being released here is acetylcholine. Okay? So, try to understand this well. So, in the somatic nervous system, okay, somatic nervous system, which is the one that is supplying your skeletal muscles, the cell body of the neuron is in the CNS, that is either the spinal cord or the brain, part of the brain. From there, this is your motor nerve. This is the lower motor neuron. This is the lower motor neuron. From here, the nerve comes out, and this is your nerve ending, and here is the skeletal muscle that it is going to supply. Okay, so this region is called the neuromuscular junction. Neuromuscular junction, and the neurotransmitter that is released here is acetylcholine, always acetylcholine. Okay? Now, when we look at the autonomic nervous system, there is a difference. There is a difference in the autonomic nervous system. In the autonomic nervous system, obviously the neuron, the initial neuron is in the CNS. Okay. So it is in the CNS. The nerve fiber that comes from this neuron, before it reaches the target organ, it will synapse with another neuron. It will synapse with another neuron. Okay. And then this will go, the nerve will go and supply the internal organ, whatever it may be, heart, lungs, liver, whatever, okay, or glands. So it will supply the internal organ. So this is the layout. As you can see, here there is no synapse between the lower motor neuron and the target. This is called the target organ or the effector organ. Whereas in the autonomic nervous system, you have a neuron in the brain or spinal cord, the nerve fiber comes out, but it makes a synapse before it reaches the organ. Okay? So this region where the synapse occurs, now we are only showing one just for ease, but remember there will be many nerves. The part where the synapse occurs, this is called the ganglia. Ganglia is plural, ganglion is singular. So ganglia is where a synapse occurs. Okay? It's outside the central nervous system. It's not inside the brain or inside the spinal cord. It's outside. Okay? And this first neuron, let's number this as 1 and let's number this as 2. Okay? 1 is called preganglionic neuron because it's before the ganglion. So it's called preganglionic neuron or preganglionic nerve fiber. Okay? And number 2, because it's after the synapse, you call number 2 the postganglionic nerve fiber. So this is the layout of the autonomic nervous system. Okay? Now we are going to see what is the difference. So this is how it is. This is how it is. Now we are going to see how is it in the sympathetic nervous system, how is it in the parasympathetic nervous system. There is a slight difference. Okay? In the sympathetic nervous system, this one, okay, the preganglionic neuron, number 1, this number 1 is in the spinal cord, okay, not the brain, it's in the spinal cord. Okay, so we are talking about this one here. So in the sympathetic nervous system, this is in the spinal cord. Which part of the spinal cord? Thoracic and lumbar regions. Thoracic and lumbar regions, okay, of the spinal cord. Now let me remind you how the spinal cord looks like. So you have seen the cross section of the spinal cord. The white matter is outside, gray matter is inside. Okay, gray matter is inside. This is the central canal. This is called the posterior horn of the gray matter. This is called the anterior horn of the gray matter. And this is called, this little thing that you see is called the lateral horn. If you remember the lab, I told you lateral horn is only found in the thoracic and lumbar regions. And it is in the lateral horn that you have this preganglionic neuron. Okay, so thoracic and lumbar regions, lateral horn. That is where the cell body of this neuron is going to be located. Okay, the cell body is in the lateral horn of the spinal cord. From there, the preganglionic nerve is going to come out. As soon as it comes out of the spinal cord, it will synapse. Okay? It will synapse with the postganglionic neuron. So the ganglion, in the case of the sympathetic nervous system, the ganglion is very close to the spinal cord, immediately outside. As soon as the nerve comes out, on either side of the vertebral column, you will find this ganglia, the sympathetic chain ganglia. They're all connected. I'll show you the picture. And then from here, the postganglionic fiber will go and synapse with the internal organ. So, in the case of the sympathetic nervous system, preganglionic nerve fiber is short. It is short. It's not too long because it's going to come out of the spinal cord and immediately synapse. So, number 1 is a short nerve fiber. Number 2, this one, the postganglionic nerve fiber is long. Okay, this one is a long nerve fiber. Okay. Now the neurotransmitter, of course, wherever you have a synapse, there must be a neurotransmitter to transmit the action potential from one neuron to the next. So the neurotransmitter between 1 and 2, is acetylcholine. The neurotransmitter between the number 2 and the internal organ is norepinephrine. Norepinephrine, also known as noradrenaline. Adrenaline is the British term, epinephrine is the American term, but they are both the same. So if you're reading anywhere, do not get confused. Noradrenaline and norepinephrine mean the same. They are the same chemical, nothing different. It's just the terminology that is used in different parts of the world. That's it. Okay? So this is the sympathetic nervous system. So all along the thoracic and the lumbar region, you're going to see the preganglionic nerve fiber coming out and then synapsing immediately. So the ganglion is very close to the vertebral column. It's very close to the vertebral column. Now coming to the parasympathetic nervous system. The preganglionic neuron, number 1. This is our number 1. Number 1 is in the brain. Some of them are in the brain and spinal cord, both places. Whereas here it's only spinal cord. Here it is both places. Brain and spinal cord. And then the preganglionic, the cell body of the neuron is in the brain or in the spinal cord. From there, the nerve fiber comes out and it's a long one. Okay? The ganglion is very close to the organ that the nerve is going to supply. So the synapse, so this is your number 2, okay, and this is your ganglion, and this is the nerve fiber coming from 2, and immediately this will synapse with the internal organ. Okay. So you see, in the case of the parasympathetic nervous system, the preganglionic nerve fiber is a long nerve fiber. It's the exact opposite. This is a long nerve fiber, whereas the postganglionic is very short. This is a short nerve fiber. Now these are the differences and you need to know all this. That's why I'm spending time. Okay. Don't think that this is not important. Autonomic nervous system is what you're going to learn is not much. So you need to know all of the things that I'm telling you today. Okay? So this is a long nerve fiber. This is a shorter nerve fiber. Now coming to the neurotransmitters. Between number 1 and number 2 here, acetylcholine. Okay? Between number 2 and the internal organ, again acetylcholine. So parasympathetic nervous system, the neurotransmitter between the preganglionic and postganglionic is acetylcholine. Between the postganglionic and the internal organ is also acetylcholine. Sympathetic is the same. Ganglion, it is still acetylcholine. The only difference is between the postganglionic nerve fiber and the internal organ, it is norepinephrine. Okay? So this you should know. So the same thing. So thoracic and lumbar spinal cord, this is the preganglionic neuron cell body, very short nerve fiber. The ganglion is outside the vertebral column, and then this is long. Whereas here, brainstem and spinal cord, I'll tell you where it is. Cell body, long preganglionic nerve fiber, short postganglionic nerve fiber. So these pictures are self-explanatory. So it's not a difficult concept to remember if you are, more visual in learning. These pictures are very good. Okay. Now, and we also talked about the neurotransmitters. So let me tell you about this. So this is what it is. So you see, from the thoracic region of the spine, so this is the cervical region of the spinal cord, this is the thoracic region, this is the lumbar region. So you have, this side is sympathetic. So you see the cell body of the neuron will be in the lateral horn of the spinal cord. It will be right here. From there, the nerve fiber will come out and it will immediately synapse. So these are the ganglia. Instead of the ganglia being separate like that, they are all interconnected. They are all connected together. They are not separate synapses like that. They are all interconnected. So we call this the sympathetic chain ganglia. Sympathetic chain. Instead of calling it just a sympathetic ganglion, because they are all connected, we call it the sympathetic chain. Okay? Now what this means is, because all of them are interconnected, whenever your sympathetic nervous system is activated, it produces generalized response everywhere. Because all of them will get stimulated at the same time, because they're all interconnected. So sympathetic nervous system, when activated, produces generalized body responses. And we will see what it will do. Because they're all interconnected. The ganglia are all interconnected. So if one of them gets stimulated, it will spread very quickly. So whenever you're in a fight or flight mode, all your organs will help you to face the crisis. Okay? Every organ, the heart, the lungs, the intestines, the kidneys, your eyes, all of them will function, okay, together, so that you're able to handle the stressful situation. Now coming to the parasympathetic. Now parasympathetic is not like this, okay, it's not interconnected. So parasympathetic, I told you, comes from the brain. The preganglionic neuron is in the brain and the spinal cord. So where exactly? So in the brain, it is usually in the brain stem, that is the midbrain, the pons and the medulla, brain stem. And these parasympathetic nerve fibers, they come out along with your cranial nerves, okay, from the brainstem. What are the cranial nerves that carry parasympathetic nerve fibers? Cranial nerve 3. Okay, 3 is oculomotor nerve. Cranial nerve 7, which is facial nerve. Cranial nerve number 9, which is glossopharyngeal nerve. And then the most important of all the parasympathetic nerves is cranial nerve 10, which is vagus nerve. So you see, cranial nerve number 3 will supply parasympathetic nerve fibers to the eye. Cranial nerve number 7, facial, will supply parasympathetic nerve fibers to your salivary glands to increase salivation. Cranial nerve number 9 is responsible for some of your internal functions like controlling heart rate, blood pressure. And then cranial nerve number 10, let me show you this one. Cranial nerve number 10, so you see this? This is 3, 7, 9, and then look at 10, vagus nerve, the most important parasympathetic nerve in the body. If anybody asks you which is the cranial nerve that carries the most parasympathetic nerve fibers controlling all your internal organs, it will be the vagus nerve. This is the most important, so don't forget this. The vagus nerve supplies parasympathetic information to all the organs in your respiratory system, trachea, air passages, lungs. It also controls your heart. It controls all your digestive organs. It controls the kidney, okay? It controls the bladder. It controls the reproductive organs. So very important parasympathetic nerve. Okay, so as you can see, the sympathetic nerve, all the ganglia are connected. Okay, whereas here it's not like that. They are all kind of separate. Okay, they're all separate. So from the brain you have these 4 cranial nerves. 4 cranial nerves, 3, 7, 9 and 10. And then the spinal cord region, the parasympathetic nerve fibers come out with the sacral nerves. Sacral nerves. Okay, and these sacral nerves are the ones that are going to supply some of your pelvic organs. Okay, like your genital organs, reproductive and all that. So this will be, vagus is up to the kidney and ureter and all that. This one, sacral nerves, will supply some of your lower, like rectum, anal canal, and then your part of your large intestine, the urinary bladder, genital organs. Okay, so this is the parasympathetic activity. So both of them are very specific. So this one is generalized. All the ganglia are connected. Here the ganglia are not connected. Each one there will be a separate ganglion. Okay, when it supplies the organ, there will be a separate ganglion where the synapse will occur, and then the postganglionic fiber will go. So to sort of show you in this one, so you see here, everything, all ganglia are separate. See, they are not interconnected. They are not interconnected. Whereas this one is interconnected all over. Okay, so that's the important thing. For acetylcholine in the parasympathetic nervous system, the first neurotransmitter that is released by the preganglionic nerve fiber is acetylcholine, and it binds to a receptor, a type of receptor which is called the nicotinic receptor. nicotinic receptor, just like nicotine that's there in cigarette smoke. Nicotinic receptor. Okay? That is the receptor to which the acetylcholine binds, and then the action potential will be transmitted to this postganglionic neuron. And then once the postganglionic neuron releases acetylcholine, the receptor that is there on the target organ is a muscarinic receptor. Muscarinic receptor. Okay? So for acetylcholine, there are two types of neurotransmitters, muscarinic and nicotinic. So we collectively call these two receptors cholinergic receptors because they are receptors for acetylcholine. We call it cholinergic receptors. If you don't want to specify, cholinergic means receptors for the neurotransmitter acetylcholine. Okay. Nicotinic receptor is found here. Okay, this one is, this is parasympathetic. So this is nicotinic receptor. Between the postganglionic fiber and the internal organ, it is muscarinic receptor. Okay, so that is the muscarinic receptor here. Now, for the adrenergic receptors, that is receptors for noradrenaline or receptors for norepinephrine, these are called adrenergic receptors, adrenaline. So, they are called adrenergic receptors. So, you have two main types, alpha and beta. Alpha and beta. Under alpha, you have alpha 1, alpha 2. Under beta, you have beta 1, beta 2, beta 3. You have subtypes. But don't worry about these. Okay? Alpha receptors and beta receptors for noradrenaline. Okay? So if you look at the sympathetic nervous system, you know that this is acetylcholine that is being released in the preganglionic. So again, because this is acetylcholine, you will have the same receptor. So it is here, it is the nicotinic receptor. It is the nicotinic receptor. Okay. What you find here will be either alpha receptor, depending on what the organ is, or a single organ will have both alpha receptor and beta receptor, because the effect will be different. So this is here for norepinephrine, you will have alpha and or beta receptors. Now, some of you may be thinking, why should I know all this? What does it matter? How does it matter whether it is alpha receptor or beta receptor or nicotinic or muscarinic? Trust me, you will take a pharmacology class. No matter what healthcare you go to, you will need a pharmacology class. All the drugs that we have either block the receptors or they are going to enhance the receptor. They are going to enhance the release of the neurotransmitter, or they will block the receptor. One common one, I don't want to go into the details of drugs, but one common one that you share, they have many drugs. There are many different drugs that are available, but one of them is what is called a beta blocker. Beta blockers. So what do you mean by beta blockers? It blocks this receptor. Okay, so beta blocker, when the sympathetic system is stimulated, the norepinephrine will bind to the beta receptors, causing an increase in your heart rate and blood pressure. So people who have a high blood pressure, we can help them by blocking this receptor so that the blood pressure does not go up when the person is resting. Okay? So trust me, every medication that you're going to learn is based on neurotransmitters. It is based on receptors. Okay? and it is based on the depolarization, repolarization, all that. So for wherever there is a neurotransmitter, there is a receptor. For dopamine, dopamine receptors. There are different types of dopamine receptors. We looked at serotonin, glutamate, GABA, glycine. All these are neurotransmitters. They'll all have a receptor. And majority of the medications that we use are either going to make these receptors and these neurotransmitters work more efficiently, or they're going to block the receptor. So that's the reason why some of this basic information you need to know. You take a pharmacology class, nobody is going to explain to you where is the nicotinic receptor, where is muscarinic receptor, what is alpha, what is beta. They're not going to explain. They would expect you to know it. Okay, they'll say these are beta blockers, okay, alpha blockers. So they're going to use those terms, and then you're going to learn what medicine does that. Okay? So for that you need to know. So this is very basic information, so don't think this is too much. So again, to summarize, you must know the difference between somatic and autonomic nervous system. You should know the difference between somatic and autonomic. Okay, and then you should know the difference between, so this is one you should know. Then you should know the difference between sympathetic and parasympathetic. Where is the ganglion, how big, long is the fiber, how short is the fiber. Then you have to know what is the neurotransmitter. You should know the neurotransmitter, and you should also know from which part of the spinal cord does the sympathetic division arise, what are the cranial nerves that carry parasympathetic fibers, which one is the most important cranial nerve, and the sacral nerves. Okay? And then you have to know the two receptors. So again, we're not going to look at specific what does alpha receptor do, what does beta. That comes later. But trust me, when you go to your BIO142, you're going to do the same thing. You're going to talk about sympathetic and parasympathetic nervous system, how it affects the heart, how it affects the blood vessels, how it affects your breathing, how it affects digestive process, how it affects urinary processes. Same thing will be repeated. At that time, do not forget what is sympathetic, what is parasympathetic, and what it does. Okay? So let's look at some of the effects of sympathetic and parasympathetic in a very generalized manner. So let's start with sympathetic. So sympathetic nervous system, whenever you're faced with some kind of a not stressful situation, even like a situation, a crisis, something that needs your attention, okay? So even exercise, okay? During exercise, your sympathetic nervous system is stimulated because you have to face that situation. And a lot of us have experienced some of these changes, okay? So what happens? What are the things that you experience whenever you are in a stressful mode, or you're going for your exercise? What are the things? Remember, it controls all your internal organs. So think about what happens.
Blood expand, blood vessels expand.
Blood vessels, okay. So blood vessels will dilate. Which blood vessels would dilate? We call this vasodilation. Vasodilation. So whenever you say blood vessels dilate, that means more nutrients, more oxygen has to be supplied, and all the waste products have to be removed. So during exercise, what blood vessels should dilate? Which blood vessels should dilate?
Artery.
What's that?
Artery.
No. Which organ blood
Oh,
vessels? Which organ blood vessels should dilate when you're exercising?
Heart.
This is a straightforward question. When you exercise, go for a jog or treadmill or whatever, which blood vessel should?
Lungs.
Huh?
Lungs, heart.
Lung, okay. Blood vessels in the heart. lungs. Okay. What else? Most important. Skeletal muscles. Yes. How do you exercise? Are you talking about exercise sitting on the couch and looking at Netflix or TikTok? That's not exercise, okay? So we're talking about proper exercise. Although nowadays the definition has probably changed. Okay, you see children playing means they play with their iPad or the phone. That's what they do. Okay, which is not good at all, absolutely. So blood vessels have to dilate. So not all blood vessels in the body are going to dilate. Only the organs that are facing maximum activity. What will happen to blood vessels in your kidney, digestive tract? So during a stressful situation, are you actually thinking about these things?
No.
No, these activities are not important. Okay? Reproductive. These activities are not important at that time. So the blood vessels in these regions will vasoconstrict. That's where these receptors come in, depending on what receptor it is. These blood vessels will constrict because this is not of importance when you are facing a crisis. Okay? So blood vessels in these organs will dilate, blood vessels here will vasoconstrict, and the blood will be shunted to the organs that require it. Okay, after all of us have a limited supply of blood. An adult has about 5 to 6 liters of blood flowing. So this 5 to 6 liters has to be adjusted somehow. So during exercise, and especially maximum exercise, your heart, lungs, skeletal muscles, and your brain, because you have to remain alert. Don't forget that. Okay? You can't sleep and exercise. You have to be alert. So the brain also needs to receive blood. So that blood has to be shunted. That same 5 to 6 liters, these organs are working at a much higher rate, much faster rate. So the blood has to be, more blood has to be sent to these organs, and that can only be done if you reduce the supply to the other organs. Okay? So that's one, blood vessels. What will happen to your heart rate? Let's say you're going for an important interview, okay? Make or break interview. What happens to your heart rate? Unless you're the very calm kind of person who never gets affected by anything. What happens to heart rate?
Increase.
Increase. Heart rate will increase. Okay? Because you need to supply the blood to all those organs. Okay? Blood pressure can increase. What will happen to your breathing rate? The rate at which you breathe will increase, because when you're resting, your breathing rate is probably around 10 or 15 breaths per minute. When you exercise or when you are stressed up, when you're going for something important, your breathing rate will definitely go up. Okay? What will happen to your blood sugar levels or blood glucose levels? What do you think should happen? Your blood sugar levels should increase or decrease? Increase, because you need more supply, nutrition to these organs that are working. So blood glucose levels will increase to supply the added nutrients. What will happen to the pupils of your eye? Pupils of the eye will
Constrict.
When you're in a stressful situation, when you want to face a situation, do you want to be more aware of your surroundings or less aware? Suppose you're going trekking at Yellowstone. You're going there and there's a bear that comes. Do you want to be able to see it clearly or not? So that you can run. Right? So what should happen to the pupils? Dilate. Okay, pupils will dilate so that you're more aware of your surroundings. Okay, so you have to be more aware of your surroundings. 7, your brain or cerebral cortex will be more alert. It will be more alert, which is what norepinephrine does. Okay, it's a neurotransmitter that alerts your cerebral cortex so that you're aware of every little minute thing that is happening. Okay, so sympathetics, the fight or flight, is going to enhance most of your, so you see, increases heart rate, increases force of contraction of the heart, blood vessels, I told you, vasodilation occurs in these blood vessels, vasoconstriction occurs. So constriction is because of alpha receptors, vasodilation is because of beta receptors. Lungs, your air passages will dilate so that more air can be taken in. Salivary glands, because digestion, I told you digestive processes will slow down. So it's not going to, sympathetic will not increase your salivation because you don't need to digest anything at that time. So the salivary secretion will become less. Okay? Pupils will dilate. The exact opposite you're going to see. When you're resting, you don't need, your organs don't need so much of oxygen. Okay? So it is going to decrease heart rate, reduce the blood pressure. Okay? There's no, remember this, parasympathetic has no action on blood vessels. Okay? No action. Because there are no receptors. There are no receptors. Lungs, your air passages will constrict. Not constrict to a large extent, but they will not be dilated because you don't need that much of oxygen. Your pupils will constrict. But remember, parasympathetic is rest and digest. Okay? So digestion requires large amounts of secretions. So your salivary secretion will increase. Okay? And then you have lots of things like that. Your sweat glands are under sympathetic control, so increased. Tears, increased secretion during parasympathetic. Adrenal glands, you will learn about this when you go into your BIO142. Gastrointestinal motility, gastrointestinal secretions. Gastrointestinal means digestive system. So digestive system enhances with parasympathetic stimulation. So that's why after a full meal, suppose you go for a party and you eat really well, after that you don't feel like doing anything because it is the parasympathetic system that slows down your heart rate, it slows down your breathing rate, and it also makes your brain less alert in the sleep mode. Because when you come from a party, you need to digest all that. So your parasympathetic nervous system becomes active, okay? And it increases the movement of food along the passages, and then it increases the secretions. So that's the reason why you feel so dull after a very heavy meal. You don't feel like working because that is this system. Okay? And then this parasympathetic nervous system is also responsible for your bladder, urination. So when you go to the restroom, it is the parasympathetic nervous system which is causing contraction of your urinary bladder to pass urine. Okay? Blood sugar levels, the same thing, sympathetics. So sympathetic is going to decrease the insulin secretion, which is again a hormone that controls your blood sugar levels, so that your blood glucose levels increase. Okay? And liver and skeletal muscle, you're going to have a lot of glucose being released into the blood so that it can be supplied to the organs. So overall, the sympathetic nervous system prepares you for a stressful activity. Parasympathetic nervous system helps you to relax and rest. Okay, and your normal activities will go on, like urination, defecation. All that is under the control of the parasympathetic nervous system. Okay? Now let me ask you a question, and this is something which is kind of practical. Now that you know this, generally, heavy exercise or severe exercise is not advocated, that is, they say you shouldn't do it, is not advocated after meals. So after you eat, you can probably go for a slow walk, but severe exercise on a very full stomach is not advised. Why do you think so?
Inhibits the digestion.
Okay, so how exactly does it inhibit digestion? Yes.
There's less blood going to your stomach, more shows like muscles, heart valves, and not peritonial digestion.
Yes, so there is, remember, because you're a trainer, so you probably do know about this. Because the reason is, rest and digest. You need, after a full meal, you do need blood. So it will be the exact opposite. After a meal, blood vessels in the digestive system will dilate. Blood vessels going to the lungs and the heart will constrict because you need more blood flow to go to the stomach and the intestines for the processes, for the digestive processes. So there is more blood flow going to the digestive passages after a meal. But if you start exercising, now you're actually confusing the body because severe exercise would require more blood to go to all these organs and especially the skeletal muscle. So now the body is confused as to what to do. So it'll affect your digestive processes because enough blood is not going there, or you may not be able to perform exercise to your maximum ability because your skeletal muscles are not getting enough blood flow. So always remember that shunting of blood occurs, okay? Because we all have the same volume. Depending on what activity we are doing, more blood gets shunted to that region. So during an exam, when you're taking an exam and trying to remember what you have studied, there is more blood flow going to your brain because that's where activity is happening. So the memory areas, all of that, that's where blood flow will be. So at that time, less blood to your digestive passages, less blood to your, some amount of blood to your skeletal muscles too, right? But other than that, this is where heart and brain, that's where blood will go. So depending on what you're doing, blood gets shunted, okay? So remember that. So this sympathetic and parasympathetic is really important because next semester when you take BIO142, every organ system that you learn, you're going to see what is the effect of the sympathetic nervous system on that organ, what is the effect of parasympathetic on that organ. Okay? Now, most often, when you look at the autonomic nervous system, each organ receives dual innervation. Dual innervation means both sympathetic and parasympathetic nerve fibers supply that organ. In most cases, okay? Dual innervation. Okay? So one division may have a greater influence than the other one, but most of the heart has both sympathetic and parasympathetic. Okay? Same thing with liver, same thing with kidney, okay? And digestive organs, same thing. So both divisions supply, okay? But it depends on which, like I said, it's always a balance. It's never one active and the other one inactive. It's not like that. They are both equal, sort of balanced, okay? So these are all some of the most important actions of the sympathetic nervous system. Most important, okay? Which is what we discussed just now. And these are some of the actions of the parasympathetic nervous system, a summary of whatever we taught. That table that you saw, the summary of that. Okay? And do not forget this. This is something you should like, you shouldn't say that, oh, I learned it for the last final exam and then I've forgotten. No, you should remember this. At least this summary, these last two slides, you should remember. Because going into your 142, when somebody asks you, when your instructor asks you, okay, what is the effect of the sympathetic nervous system on the heart? You should be able to say that. What is the effect of parasympathetic on the digestive system? You should be able to mention that, or at least you should remember. Okay? Right. So this is what we say. The effect of both the sympathetic and the parasympathetic, I told you it never goes away. There is always a balance. We call this the autonomic tone. Autonomic tone. That means some amount of activity is there in both sympathetic and parasympathetic, and it fluctuates based on your whatever you're doing. So at this moment in time, it's daytime, you're in the class, you're trying to take down notes, you're trying to understand. So your sympathetic will be higher. Parasympathetic activity will be lower. A little while later, when you go for lunch, go out, have your lunch, your parasympathetic activity will increase, your sympathetic activity will decrease. So there is always a fluctuation going on, and that is what we call as autonomic tone. So no particular system shuts down completely. It's always, there's a constant activity that is going on. And the highest level of control for the autonomic nervous system is the hypothalamus. Okay, do not forget that. Hypothalamus is the highest level. That is where you have the control for both sympathetic and parasympathetic. Okay, I think that's about it. Oh, have you heard of this? Have you heard of POTS? Anybody? Because I've had students who had this before. POTS is postural orthostatic tachycardia syndrome. Okay, a lot of young individuals do suffer from this. What happens is when you move from the sitting to the standing, or from lying down to standing, when you stand, the gravity is acting on your body, and it tries to pull the blood down. Okay, the blood comes down into your legs. So your blood pressure will drop a little bit. So blood flow to the brain will decrease. So the normal homeostatic response is, as soon as you move from sitting to standing or lying down to standing, your internal receptors, so this is a reflex you will learn next year. This internal receptors will detect that the blood pressure is dropping. So your heart rate will go up and your blood pressure will go up, so that adequate blood flow goes to your brain and you don't faint, you don't lose consciousness. Okay? But what happens in people who have this POTS, they do experience dizziness and, low blood pressure when they change a position from lying down to standing or from sitting to standing. Okay? And the heart rate will also abnormally increase. So for normal people, the increase in heart rate, if you're lying down, if your heart rate is 60 beats per minute, when you stand up, your heart rate will go up by about 8 or 10 beats, maybe 70 beats per minute. But in these individuals, the heart rate will be extremely high. It'll go to 100 beats or more than 100 beats per minute. And as soon as they change their position to the standing, and their blood vessels will dilate and the blood pressure will drop. Okay, so they are not having the normal reflex. So when their blood pressure drops, they feel dizzy and they may faint. And they also have other effects like, shortness of breath and sweating, and all that is there. We still don't know what is the exact reason for POTS. Okay? But it is thought to be that in these individuals, there is excessive sympathetic activity. So when you are changing your position from lying to standing, your sympathetic nervous system is activated. That's why your heart rate goes up, your blood pressure goes up. But in these individuals, there is excess sympathetic activity, too much, which ends up with the heart rate becoming so high and the blood pressure dropping instead of increasing. So they are extremely sensitive. So their receptors are very sensitive. So that is the reason for POTS. That's what we are thought to be. The symptoms are like that. But what exactly is the cause, we don't know. Why some people have this, why some don't, we don't know. Okay? So the treatment for this is that you generally ask them to drink a lot of water, take a lot of salt and water solutions, and then try to exercise, give them an exercise regime. Okay, and when they change position, ask them to do it slowly without doing it too fast. But this is where I told you sympathetic receptors. So you can block the receptors so that the sympathetic activity is not exaggerated. So you can block the beta receptors so that the heart rate doesn't go up so much. So they are given symptomatic treatment. It cannot be cured. Some individuals, they improve. With time, they improve. But some of them have to live with it throughout their life. Okay? So this is just an example of how the sympathetic, the autonomic nervous system can cause issues. Okay? And there are many other conditions as well. Okay? But this is a very common one, so that's why. Right? So that concludes our autonomic nervous system lecture.